Hi, this is Russ Ward, and I'm with Pixels and Pills, and I'm with Michelle Samplin-Salgado from AIDS.gov. Michelle, how are you?
Great, thank you. How are you?
Good, thanks. Can you tell us a little bit about why you're at this social media conference and a little bit about your organisation?
Sure. So I'm Michelle Samplin-Salgado. I'm the new media strategist for AIDS.gov. AIDS.gov is a federal portal for HIV information. It's in the Office of HIV/AIDS Policy in the Department of Health and Human Services. And today we came to talk about our mobile presence and kind of two facets of our mobile presence, how we develop our mobile website and also a mobile HIV locator to connect people with HIV testing, prevention, and treatment services.
So tell us a little bit about the mobile part of the equation here and how that works.
Sure. So for us, we have a framework at AIDS.gov that we like to think about where we think of the context, the content, and then the container for most things that we do. And how this applies to mobile and with the HIV community is the HIV disproportionately impacts people of color and other underserved populations. And so we also know about these same communities that they are more likely to access the web using a mobile device. So based on looking at the search terms, looking at the hours that people are trying to access HIV/AIDS information, we've shifted our mobile site to adapt to that. So our desktop site, we get a lot of questions about funding resources and HIV numbers and things that people are kind of doing when they're at work and how they're thinking about HIV in that context. On the other hand, on our mobile device, we're getting very intimate questions about how HIV is transmitted, why they might, if they're at risk. And so we've adjusted our mobile site where that information, how do I get HIV, that's the priority information. That's the first thing that people see. Actually, people bypass our mobile homepage and go straight to the page. Our most popular page is how do I get HIV on our mobile site. And so we're really trying to look at that context, that content, and then fit it to the container, which is the mobile site in this case.
So I guess there's some real challenges in knowing what the language is, the cultural variations of the lingo, as it were, as well as the presentation of the information through the mobile phone networks, because perhaps that's often the only way people get access to the internet in this demographic.
Right, absolutely. So that is certainly something that our users are always involved. So we're not just looking at what their search terms are and then creating the content in the language that as a government entity we feel is appropriate. We're working with our users along the way. So looking at what they're searching on, looking at the hours, looking at the content that is most applicable and relevant to them is the first step. But then using them exactly to work on the language and to work on what that content is, how to frame it and position it is another step as well.
Excellent. So what else would you like to have as a takeaway here for today from the audience that may be watching?
Sure. So there's one other thing that I spoke about, and that's the HIV/AIDS service locator. And so that we also have that on our mobile device. But what we've been doing, this related to Todd Park's presentation. So Todd Park this morning spoke about access to data and using data. And so at AIDS.gov, we're working within the government to use databases from SAMHSA, from CDC, from across the government that has information that are relevant to people, either at risk for, or living with, or at some level impacted by HIV/AIDS. And so we've made that available on a mobile device. We've made that available on our desktop as a widget. It's locator.aids.gov. And that's something that we're particularly proud of. It's taking the context of people when they're looking for information, the content, which is information about prevention and service and treatment for people living with AIDS, and putting it in various containers. So the locator.aids.gov is something that I would also like to share.
So Michelle, this has been very interesting as innovations coming from the federal government to help with healthcare for AIDS sufferers. Thank you very much for your time today. We look forward to seeing you again in the future.
Thank you.